Around 60% of a nurse's job is documentation. The documentation fatigue is absolutely a big factor for many of our GPs. Four lessons that I learned having visited all these GP practices around New Zealand. Hi, my name is Kalolo and I am one of the founders of AI Health Academy. So myself, as well as Florian, my co-founder, decided to come together and to go on this trip to really understand, to listen, to empathize, and see how GP practices all over New Zealand are using digital tools, including AI tools, in reducing inefficiencies. Going on this trip was also very personal to me. I have a whānau mother who has been sick a lot recently and has been in and out of hospital and has been going to the family doctors as well just down the road. And one thing that I've come to realize, and actually just happened a couple of months ago, I had my sister message me and say, hey, I have to take work off today because I have to sit in here with mum to ensure that she's able to see a doctor. And that took about 5 to 5.5 hours. And that really opened my mind and made me think about my parents, my mum and dad, and being in their 60s, what happens when they have to enter into the healthcare system to go to their local doctors? Do they have to wait that long? Why are they waiting that long? It made me very curious, especially in this new venture that Florian and I are going through at the moment as we try and help use our skills to solve the pressures that we have in our healthcare system, especially primary healthcare. So my first learning is that GPs document a lot. If you're a patient going to a family doctor and consultations typically take about 15 minutes, a doctor will be there with you to understand what you need, perhaps give you a prescription depending on what type of conditions that you have. But at the end of the consultation, a doctor needs to document. And if you were also to scenario base that a doctor takes about 3 patients per hour, 15-minute break if needed for documenting, times that by 8 hours for a shift, that's about 24 patients that they need to document for throughout the day. And if I was, say, a doctor documenting for 24 patients, and if you were to times that by the amount of days that you're working per week, I get why they go through a lot of documentation fatigue. And I understand why this also contributes to some of the pressures that we see in our healthcare system. There is something else that we've also tried to figure out as we've traveled all over New Zealand, is how are GPs trying to solve this using digital tools. And the reason why we say that is because there are a lot of artificial intelligence scribing tools that are available today. About 10 to 15% of GP practices that we visited are already using these type of tools because the problem is real. The documentation fatigue is absolutely a big factor for many of our GPs. Tools such as Nabla Copilot and Heidi Health have been some of the common AI scribing tools that we've seen a lot of practices use. Instead of a doctor typing notes after a consultation, they can press a recording button. So they can click on a button and it allows for an AI scribing tool such as Nabla Copilot or Heidi Health to record the session. And this session is recorded and is also transcribed into notes that are familiar for GPs. And if you think about it this way, this helps reduce documentation fatigue and hopefully over time allows for doctors to see more patients. So these are some of the things that I've come to realize is, a lot of the pressures that we've seen comes from the clinicians or the professional themselves. We need to make sure that we look after our doctors to understand that what's in here, because they're using a lot of their mind to consult and to also document, that we can reduce a lot of that. One thing we've also come to see is we need to think a little bit more deep of how we apply these tools into our practice. One of the key ethical considerations that we need to be mindful of is patient consent. How do we let them know that we're recording the session? Can we give them comfort knowing that what has been recorded is there for privacy and we abide to privacy rules that exist in New Zealand? So that is some of the common things that we've seen as part of applying these type of tech tools in practices today. Even as simple as patient consent forms, adding in an AI clause into enrollment forms for new patients, even posters for awareness so patients understand what types of tools are being used used to help reduce inefficiencies. The second learning is we just don't have enough actual doctors in New Zealand. I read a statistic recently from the New Zealand Medical Journal that shows that we have a shortfall of 1,700 doctors, and this is projected to be 3,400 shortfall by 2032. As we visited a lot of these GP practices time and time again, we were told by practice managers especially is that we just don't have enough doctors. And this is quite concerning. You know, if I'm thinking about some of the travels that we've done throughout, especially rural areas, are the ones that struggle the most. Because if you think about it, we have a large proportion of doctors that are retiring and a lot of doctors that are being trained up locally in New Zealand going offshore, especially to Australia. And it made me think also, like, how are we solving this issue right now? International medical graduates. These are doctors that have been trained from overseas and come to New Zealand for work and for a better life. But another statistic that has also been shown is that international medical graduates only stay in New Zealand for, on average, 2 years or less. And it just makes me really think, like, why is it so? Like, is it the culture? Do they feel like that coming to New Zealand was a great decision? Is it because this was a pit stop to go to Australia? Right, so how do we solve some of these issues? And it's something that I'm really thinking about as I've gone and traveled to these different GP practices. There is one thing that we can try and solve by reducing documentation fatigue, but there's another where we actually need more doctors in here to see more patients. There was one town that we had visited and had about 5 GP practices in that town, and not one of them were taking any patients. They closed their books. And in fact, some of these patients that weren't able to see a doctor or not able to go to any of these GP practices to have a consultation had to travel outside of the rural areas to the main towns. So it just really goes to show how under pressure our GP practices are, given that we just don't have enough doctors. So that's something that we've been really thinking about how we can try and solve. One big pattern that we're seeing is there are a lot of locum doctors. So locum doctors are contracted doctors that come and temporarily go to different GP practices to consult and to help solve the day-to-day pressure issues that GP practices may have. So it's quite common to see a lot of the locum doctors traveling all around New Zealand or staying in a particular town or focused on particular GP practices and solving it that way instead of them being permanently in New Zealand. But it doesn't stop the fact that we do need permanent doctors that would love to live in New Zealand and can help support us in reducing these inefficiencies. The third lesson is that practice managers and administrators play a big role in our GP practices. When we traveled and visited these 100 GP practices, we walk into these stores and the first experience that you have when you walk into a practice is the reception or the front desk. Those that are at the front, as well as the team at the back as well, play a massive role in the overall operations of a GP practice. Things such as clinical scheduling, patient coordination, compliance, governance, financial budgeting. There's so much that practice managers and administrators do in order for the system to be efficient, for the GP practice to be efficient. So it's very important to acknowledge the hard work of our practice managers and administrators in our primary healthcare system. We realized the importance of these roles that halfway through our North Island trip, we decided to go to the PMANS conference. So we booked our tickets, go back to Auckland and to visit this conference. Just made me realize how important it is to have these roles in our GP practices. This conference was amazing. We were able to listen to so many thought leaders. We had Minister of Health Shane Reti also attend and also some special guests, but it was the topics in the conference that mattered the most. So it was really good to get some of those insights of what is on the top of the mind of our practice managers and administrators. And some of the key themes is how do we use technology to be much more efficient in the things that we do? Tips and tricks on such as ACC forms, the new models of healthcare, how to manage your finances, the role of artificial intelligence in this new world. A lot of these topics were discussed. And what's really great is you have so much passionate practice managers and administrators all around New Zealand come together to think innovatively, creatively, and at heart, ultimately for our patients and our GPs and nurses. And the fourth lesson that I've learned is that nurses are the backbone to our healthcare system. And having to listen and understand what makes up a lot of their work was very profound and very humbling for me to understand. Around 60% of a nurse's job is documentation, care plans, charting, There's so much to do progress notes. I remember one time going to New Plymouth and walking into a GP practice there and seeing some nurses sitting on their computers, and having some of the nurses sit there and talk to us while simultaneously typing at the same time. And that made me think on some of the issues that they are also going through in our primary healthcare system. And I do not want to forget how important our nurses are when it comes to running our primary healthcare system. Appreciate all the work that our nurses do as we've gone around and visited these GP practices, including our midwives. 3,500 to 4,000 midwives that we have in New Zealand play a big role in caring and ultimately being there with their empathy for our patients. So there you go. 4 lessons that I learned having visited all these GP practices around New Zealand. I acknowledge the hard work, the challenges that are being faced, and the opportunities that lie ahead for our GP practices. So whether you are a GP, a practice manager, a nurse, or any other professional that relates to GP practices, this channel is for you. Thank you for joining us in our journey. So don't forget to subscribe below and to look forward to many of the other videos that we will share with you throughout this journey.